I'm Champ from Champ Elite Wellness. We're going to go ahead and just get this ball rolling. I know if you're located in Atlanta today, you've been dealing with a lot of outages. So bear with us if we're having any technical difficulties. So I'm Champ for Champ Elite Wellness, and I want to welcome everyone to our Champ Elite Wellness webinar. Today, we'll be talking about new normalities and wellness within the workplace, and the accessibility of wellness moving forward. Um, Champion Elite Wellness, we're a health and wellness vendor. We take pride in providing a wide variety of health and wellness services, all the way from physical fitness, nutrition, and all the eight dynamics back there. Yeah, all the dynamics of wellness, we take pride in making sure that we provide custom fitness and wellness services all the way across the board, through and through. So anything within health and wellness, from team building projects, nutritional facts, or lunch and learns, workshops, we do that, and we make sure we customize it for your company's culture. Today, where our main objective is, we're going to address some health and wellness barriers, and we're also going to provide some effective and affordable access to EPA, employee assistance programs. We do this all the way from locally here in Atlanta, Georgia, where what we're local here in Atlanta, Georgia, and also we provide health and wellness programs domestically and abroad. So one of the things, what I wanted to do is really introduce some of our panelists in a way that's really unique. I want people to really just what we're noticing now is that health and wellness is not a cookie cutter type of situation now, especially when we're dealing with these nuances. So I chose these panelists especially for the trying times that we have now, because they give us a new version, a new perspective, with that old fashioned feel of some of the baseline things that are necessary and needed within the health and wellness space. So to my top left, we have Kim Brinson. She is she's been rocking with me for years. She's amazing. I call her a yoga expert. I don't even know if she likes to take that title, but she's a veteran in the game. I'm the lead health and wellness coordinator here at Champion Elite Wellness. We have Tony on our right hand side. She is an amazing mental health specialist that she really brings great perspective to mental health and how we address it. Also, we have one of my main guys. He's been not just a mentor for me, but a great friend. He's a board certified and I made sure I said this right, internal medicine physician. So he is really key when we're talking about updates, what's happening, the nuances, and even being able to go within companies and help us with that health screening and all the things that we need when we're going into a new company. And one of my road dogs and my boys, man, Derek, he is really, when it comes to health and wellness and really bringing that digital aspect, he is amazing. And by all means, we hand selected these panelists. And so thank you guys for being on with us and taking the time out. So if you guys have anything to say, cool. If not, we're just gonna dive right in. So as we continue to move forward, we want to know the biggest thing. We want to figure out the baseline. We want to consider where we are now. What do we know? We know that health and wellness, more now than ever, is extremely important. With the nuances, with the new normalities, with chronic conditions are at an all-time high. Chronic conditions are one of our leading causes of mortalities, and 6 out of 10 adults within the United States are suffering from some version of chronic conditions. So out of us, there's a few of us that are suffering from some version of chronic conditions. Now, and when we say suffer from chronic conditions or chronic diseases, it sounds so outrageous in a sense where it is. It's crazy and it's high, but it's something that we can address and something that can be addressed. Chronic conditions can cover hypertension, high blood pressure, diabetes, depression, anxiety, stress. And I know Tony will be one of our amazing panelists to talk about just stress and anxiety in the workplace, and now that we know at home now, heart diseases, all of these things are versions of chronic conditions. And when it comes to corporate America, 90% of our nation's 3.5, I said $3.5 trillion in healthcare expenditures go straight to chronic diseases and chronic conditions and mental health conditions in the workplace, and now, as we know, at home. So we're talking about trillions and trillions of dollars are going into health conditions within the workplace, and these are a lot of times these are health conditions that we want to start breaking those barriers of the stigma. And these are things that we can address now, and companies are really getting an edge on understanding that investing their finances and their time and energy to check on their employees are becoming more important now than ever. And when I say now than ever, we know we're dealing with post-COVID, and what better time than now to introduce Dr. Kevin Goodlow, and he's going to give us some kind of direction and kind of updates on where we are with post-COVID, how things are happening, how things are unfolding, and how we can move forward. Dr. Kevin Goodlow, without further ado, it is all you, brother.
Good afternoon, everybody. I wanted to make sure during this talk that we focus on what we know now. What has changed when this virus when we first confronted it in March of this year as an entity in the United States. We didn't know anything about it. We didn't know exactly how it would spread, how to treat it, and we had a very high death and mortality rate because of that.
Can you guys hear Kevin? I'm sorry. Can you guys hear Kevin?
And so what we know now is that coronavirus is spread through respiratory droplets from person to person. That can occur either from being directly in contact with a person or from aerosolized air droplets in the air, floating through the air that you walk into.
Champ, I think you need to tell Dr. Goodlow to unmute, and then
One second, guys. I apologize. Once again, we're dealing with so many type of technical difficulties. I don't think we can hear Kevin. So let me drop out of this share. And
you should just have to unmute, and then because we were hearing him through yours.
Oh, okay. Kevin, you can go ahead and unmute and. Yep.
All right. So what we know is that coronavirus is spread through respiratory droplets. So we'll start back off at the beginning. And what that means is that you can obtain coronavirus from air droplets or respiratory droplets that come from people's mouths or noses when they cough, sneeze, or talk, or sing. And sometimes these droplets can become aerosolized, or where they float in the air. So you can actually become COVID positive from exposure to respiratory droplets from a person who has COVID, who you've never spoke to, or you've not stood in front of. These droplets were just in the air, which is why it's important to know how to protect yourselves. What we also know is that the virus lives on certain surfaces for up to 3 days. And so that underscores some of the mitigation factors that the CDC and the White House Coronavirus Task Force put together to help the community at large understand how to avoid contact and to decrease the risk if you have to go out into the public. So the ways that we know now to protect ourselves and our families include frequent hand washing. And that goes right back to that idea of the COVID virus living on surfaces for 3 days. So if you get coronavirus on your hands, either from respiratory droplets where someone coughed in their hands, or from a surface, and then you touch your mouth or nose or eyes, then you can become COVID positive from that exposure. That's why we underscore so much in the healthcare community, making sure that you frequently wash your hands so that you can avoid yourself of that contamination. physical distancing, and I like to use physical distancing rather than social distancing, because you can be distant from somebody and still socialize with them, especially now with technology. But the physical distancing is really important. And the reasons for that is because we talked a little bit earlier about the respiratory droplets being ones that can sometimes float in the air. If you're staying at least 6 feet away from other individuals, especially ones that you have not had close contact with in the recent past, and you don't know their COVID status, you're probably going to do yourself justice and do a really good job in not becoming COVID positive and not being exposed to their respiratory droplets. One of the other big things that sort of goes hand in hand with physical distancing is wearing a mask. And the mask is really more about you protecting other people from your respiratory droplets. So when you cough, sneeze, talk, etc., sing, those respiratory droplets go out into the air, and like I said, can become aerosolized. When you wear a mask over your face and over your mouth and nose in particular, what you're doing is sequestering those respiratory droplets within the mask, or at least a good portion of them. So there's a lower tendency for the virus to be able to become aerosolized or float in the air, and it decreases the risk of transmission to other people. And then finally, avoiding large crowds. And this is really a mitigation factor that we use that's mostly about just common sense. The more people you're exposed to in one given time, the more likely you're going to be exposed to somebody who has the coronavirus, or who could potentially expose you to it. So if you limit the number of people, then you by definition are limiting your risk for COVID. I think this ties directly into the ways that corporate wellness is important and how we need to look at it, because folk are literally dying. I work in a couple of different hospitals in the area where we've had the units full of COVID patients. And that caused, both in our hospital system, but also in offices around the country, a lot of stress and anxiety, and even depression, especially from some of the social distancing. So I wanted to underscore during this conversation that those mental health issues are real, and they do affect people real time, and their ability to be able to function at work, to be productive at work, and the morale at work. And so the same way that I think that Justin alluded to earlier, the financial impact of coronavirus, I wanted to make sure that we addressed some of the human impact, because it's equally costly to employers when they don't address some of those issues. Some of the ways that you can decrease the level of anxiety and stress and fear within the workplace is by mandating a mask, or a mask mandate, mandating that everybody who comes into the office wears a mask, so that the staff and employees can feel safe and not be scared to go home, or scared that they're going to expose their family to COVID because they had to go to work. Bring hand sanitizer. It's becoming more ubiquitous now. Early on in March, April, and May, you probably couldn't find a bottle of hand sanitizer to save your life. Now they're all over the place. You can get them pretty much every store you go into. And it's important to make sure you have that at home and in your vehicle, so that you can be frequently washing your hands. Daily temperature checks for employees is also a good idea, partly because what we do know is that a lot of patients who develop COVID end up with high fevers. And so having a fever in itself obviously doesn't mean that you have COVID. There's multiple other viruses and other illnesses, both bacterial and otherwise, that can cause a fever. But knowing that you have a fever could give you a head start on making sure that you're not, making the mistake of not wearing a mask, or not physical distancing, and not taking the steps to prevent spread if you could potentially be infected yourself. What we're doing now, virtual meetings, it's important, and it helps to de-stress and decrease anxiety within the workplace when you can work from home and be equally as productive, but get some of those some of the issues around being in the public out of the arena of work, and it just decreases stress and helps mitigate the spread of disease. And so those sorts of things, working from home and virtual meetings, are all sorts of things that we are doing now, and that I think we should be encouraging employers to use as tactics to help decrease workplace stress and anxiety and depression. Finally, some of the ways that you can adjust just as individuals that we know work for a multitude of stressors, not just COVID, is exercise. And that's right down Justin's vein and line of work. And it's really good in helping to de-stress and to work out some of the tensions that are there from just your workday, and also stress and fear around COVID. Outdoor activities are important. And when I say outdoor, I mean sort of outdoor, not in a crowd. So going to parks, lakes, rivers, places where you don't have to be around a lot of people, but you can get to see something outside of your house can be very helpful to decrease stress and anxiety. One of the things that I've tried recently is aromatherapy. Get some lavender and eucalyptus and have it sort of permeating through the air. It's relaxing. It helps you feel good. And you can do this both at work or at home. And then finally, online social groups is another way to just stay relevant, feel like you're still in the game, feeling as though you're still able to interact with people because that interaction is not only helpful for you, it's helpful for other people who are also suffering with some of this physical distancing that we're doing now during COVID. So those are some of the human costs to COVID that have nothing directly to do with bottom line numbers, but they're human costs that I think employers need to be aware of in this era to prevent workplace stress, anxiety, and depression.
Yep. And what we're, you got the mute, brother. What we're noticing in the workplace that just with stress, anxiety, and these are all direct cost when it comes to the workplace. The direct cost is insane. It's direct and indirect cost, absenteeism, higher loss in productivity, short-term and long-term disability, overstaffing, temp workers. A lot of these indirect and direct costs that we know are being overlooked. It's costing companies, as we can see, trillions of dollars. And what we want to do is we want to kind of put that in the reverse process. We want to be conscious of where our company is, like I said, with lost productivity, absenteeism, and how much money are we spending in claims and how much companies are spending in just medical claims alone. And so when we are saying that we want to reverse this process, we want to make sure that we help companies provide them accessible EAP, employee assisted programs like us and vendors like us that can help you with these reverse in cost. And as we continue to talk about the chronic conditions, mental health is becoming higher than ever. Anxiety, stress, depression. And when we decided that we wanted to make sure that we are covering and address this, we thought long and hard. And what better person? And I've known Tony for years, Tony Jones, and she's just a very impactful person and very influential when it comes to workplace mental health and how we can start to put the costs in reverse and actually start to save companies monies. And our biggest objective and goal here is to begin to save lives. So Tony, with all due, let us know where are things at with mental health and what is mental health? Because it's a big stigma, and we'll talk about stigma. It's a big thing when people talking about mental health. Is something wrong with me? So could we help kind of reverse that thought or kind of figure out what mental health is for people?
So mental health talks about anything that deals with our mind.
Everybody's muted. Yeah, I think you're muted.
Did you mute me?
Man, we should be able to hear you.
I hear you, Tony.
Can you?
Sorry.
Oh, okay, great. So, so with mental health, we're dealing with anything that impacts the mind, emotions, feelings, thoughts, which in turn deals with our behavior. We're looking at what are the things that are impacting your ability to complete your daily living activities. We are looking at bringing awareness to the importance of your mind, of your emotions. How does that impact you on a day-to-day basis? How does that impact your ability to get your work done? How does that impact your ability to interact with your family, with your friends, and those types of things? Because all of that comes into play. When we talk about it, what we know is that when people are healthy in the mind, their bodies will follow suit, as will their actions and emotions. So being able to recognize when you're not okay, being able to recognize when you have reached your breaking point, being able to recognize when you are overwhelmed and you have had enough, it's so vital, because so many times we will push right past those woo, woo, woo warning signs to let us know, hey, this is going too far, in an effort to be productive, or in an effort to keep going, or in an effort to quote unquote be strong. But it comes at a price. And it's a pretty steep one at that. When it comes to what we provide with Champ Elite Wellness, we can tailor, and we do tailor our workshops to each company's culture. So for instance, if you are a company that has high stress, we absolutely would do things that deal with anti-stress, that will deal with balance, that will deal with reducing anxiety. If you are a company that is looking to bring togetherness and cohesiveness, let's get on a hike. Let's get out in the woods. Let's talk. Let's process. Let's bond. Let's get together. Let's grow. Let's be bigger. Because behind home, work is the next place that people spend the most amount of time. So if there is any way to increase productivity, it's about increasing and strengthening the relationships and the bond between employees, employers, supervisors, and everybody, because it's a whole company. It's not just one person. Yeah. So what can you do now? Well, you can book with Champ Elite Wellness and go ahead and let's get set up on a hike. Let's go ahead and get us on your book for 2021 because we're doing some new things. So in encouraging your employees to get off on time, encouraging them to take paid time off, encouraging them to set boundaries about the amount of time that they work, being understandable, increasing flexibility, tweaking expectations. All of these things will have a huge impact that will ripple out into your company at large.
Yeah, absolutely. And I threw this with that, Tony, and she doesn't even know about this slide. I threw it in because what we're noticing is that there's a lot of barriers that exist in the workplace. There's a lot of barriers when we're talking about really addressing it. And we're in partnership with 5 or 6 different companies, and we're doing health and wellness programs for over 1,500 people. And what we're noticing is it's the stigma. And I'm throwing this at Tony because I'm going to let you really talk about the lack of education, the cost barriers, and the lack of professionals in this space that can not just be cookie cutter, but that can conform our programs to what is needed in the workplace, not just what's suggested.
So the challenge with mental health is that for so many years, there was this awful light that was shed on us, that the only reason you saw a therapist or a psychiatrist is that you were crazy or something was wrong with you or you were touched in the head. But the truth of the matter is everybody needs a therapist, because the whole point of coming into therapy is so that you can have a safe place to process your thoughts, feelings, and emotions. It helps you to recognize your own patterns of behavior and figure out where you can make a change. It's a fantastic place to learn coping skills. And therapy is great because most of the people in therapy are there because other people won't go to therapy. So it is what it is. A lot of people don't know that, like, there are different types of therapists. You can have a mental health therapist, you can have a recreational therapist, you can have occupational therapy. Like, there are different modalities. And then even as a mental health therapist, you have different treatment modalities that you use. So there is cognitive behavior therapy. So looking at the connection between emotions, thoughts, and feelings. There's person-centered. There's what we call short-term solution focus. There is dialectical behavior therapy, so recognizing how two things can be opposite and the same at the same time. Like, there's so many options out there. And therapists are getting more and more creative, because I have a really good friend who is she's a run therapist. So her practice incorporates a lot of running, a lot of eating right, lots of kind of things. So it's no longer just sitting there with someone staring at you doing what we call the counselor hands and just staring and saying, well, how does that make you feel? Yeah, that's a part of it, but that's not what it looks like anymore. It's not quite so stuffy. We recognize that therapy can be expensive, and it can be cost prohibitive only because a lot of insurance companies in the past would not cover mental health services, not realizing that we are under the umbrella just like the medical side is. And that a lot of times medical issues that are showing up physically can be psychosomatic, meaning that because of something that's going on in the mind and the thoughts, it's showing up in the body. There used to be a lack of healthcare professionals who provided therapy, but the truth of the matter is more and more people are getting into the mental health field. More and more people are understanding what mental health does. There are a variety of us, and we can serve in a multitude of populations. We are showing up everywhere. There are all kinds of like podcasts and things like that. There's things for like therapy for Black girls, Black therapists rock. There are some other podcasts out there that deal with like internal family systems, which is another modality up under mental health. So it's out there. There are plenty of blogs that can help you to connect with mental health professionals to get what you need.
And what I'm noticing is, and we can actually, Champion Elite Wellness, we can help you with that access. A lot of times, we don't even companies don't even know that they have if you go with your insurance providers, they have something called EAP programs. These are employee assistance programs that they put money aside for you to have access to for your employees. So Champion Elite Wellness will help you with that transition and that process with finding financial gain when it comes to serving your employees. And I'm so glad that you said something about the different dynamics, environmental, intellectual, occupational. That's one of the things that we want to kind of come into Champion Elite Wellness. We want to, and that's what makes our company unique. We make sure we address all of these spaces, and we customize all of these spaces as far as fitting things for your culture. Nothing's cookie cutter no more. All the way down to our physical fitness. We have a platform that we call Champ Fusion, and Kim is our rock star when it comes to physical wellness and just being able to intertwine that physical wellness with the backing of that mental too. So without further ado, one of my really good friends, she's been with me from the beginning, Kim Brinson. Let us know just about physical fitness, Champ Fusion, and the benefits moving forward.
Yeah, so Champ Fusion Fitness is one of the ways that you can bring this into your corporate environment, but it's very specialized for the things that you want to accomplish in your business, in your corporate structure. And so it's bridging the gap between the mental and then the physical and how you put those together. So it could be a HIIT workout, and that may be completely appropriate, or it could be yoga, which is my specialty. But Champ has elite trainers that are certified through him that can cover all of those scopes. So no matter what you're looking for, this platform can cover it, which is really great. Yoga being my specialty and it being the thing that I really think helps bridge that mental physical gap, because you get to put them together, because you are now incorporating breath work with movement and also meditation, all in 30 minutes, 45 minutes, 10 minutes. I mean, gosh, if you can spend any of those amount of time with it, I think that is super beneficial for all workplace employees, because the benefits are enormous. It increases your energy. It makes you ready to go. If it's a lunchtime workshop, that you're ready to go back into the day and you give it all of your effort instead of having that 3 p.m., oh my gosh, I don't know if I want to do anything else. So you're increasing productivity with your employees throughout the rest of the day with that. COVID is definitely bringing challenges to that, but Champ Elite Wellness is one of those things that is working on different ways to bring that to you. So this is my home studio, and I do yoga all day long for different corporate events, and it's been really, really great. I get to talk to a lot of people. We get to still stay connected, because these are the same people that I used to see in their corporate gyms, and now they're here online with me. And we do that check-in, hey, how you doing? Which is our first part of getting ready to go onto your mat and finding your breath work, finding that flow, finding that movement, finding the places that you're tight, finding where you're holding that anxiety in your body and naming it, and then give the opportunity to release it. So that is, you know, using this physical movement, this physical form, this physical practice that we get to do together, and letting it help with that mental health component that we are striving to really keep going.
Absolutely. And you said a key word, connect. And one of the things that we really want to take pride on with Champion Elite Wellness is keeping the company connected. We're like I said, we're partnering with some companies, and the biggest thing for them right now is how do we continue with the morale? How do we continue with letting our employees know that we care? Initiating fitness and wellness challenges. How do we connect all of that? And once again, we take pride in just being a one house that we can provide all of this type of employee assistant programs, and in perfect connection with Derek. Derek really is he backs this company 100% and really help the connection from employee to employee to department to department, and really bringing that wellness portal to the forefront and allowing that connection to still happen from employee to employee, department to department, and from building to building domestically and abroad. So Derek, man, how are things with the wellness portal and app and staying connected? Tell us a little bit about that.
Yeah, well, thank you for the introduction, and obviously for having me here. It's a pleasure to be speaking with everyone. I would say wellness portal is kind of becoming more of a buzzword each and every day. So I want you guys to think of a wellness portal as basically like a digital central hub for your entire employee wellness program. So it's basically like the center point of emphasis where individuals can go for contact with these different dimensions that Justin and the team are talking about. So the interface is primarily through a mobile application, as you'll kind of see some branding here, as Justin gave some examples. But there's also a URL environment for individuals who might not want to go the mobile route. But one of the key things that I've heard many of my colleagues talk about here today is customization. So if I'm thinking about customization, I want you guys to think about a few different things. Is obviously you're working with the team. No two companies are the same. We can't give a cookie cutter experience to companies or else they're going to fail. So what the team needs to do is we'll sit down, analyze what are the specific dimensions your organization needs. So think about customization as if you're a very fitness intensive organization, maybe you're completely remote and you just want people to get up, get moving. There's parts of the fitness aspect of the system where you'll be able to interact with workouts, or maybe you'll do a live stream of a yoga session, or maybe you'll track progress metrics, etc. Or you might be working with another company who, you could be investment bankers who have high stress all the time, or sales representatives who obviously mental health is a big thing for them. So being able to incorporate some kind of mental aspects for them. Or you need the social element. As Dr. Goodlow was saying earlier, we want to physically distance, but we don't want to socially distance at all. So if you fall into all those categories or kind of any one of them, there's a custom model made just for you. And the other aspect is for the customization, there is also the opportunity to brand it to your organization as well, which can help a bit by using logos, color schemes, etc. So I guess, based off of that, if you're asking me what are the big benefits, for number one, it's more engaging. As simple as that. It's going to get more engagement than other platforms out there. One thing to point out is the mobile application is a center focus of the program. And that's kind of by design. I mean, people are 50% more likely to open up push notifications. So it's a powerful tool to be able to deliver messages, get them involved in different initiatives via the mobile application. We also know lots of uncertainty into the world right now. I don't think anyone who's listened to this now live or recorded will disagree with that statement. And because of that, I've even spoke to a partner, a business partner today, who was telling me their offices already announced that they're closed through September of next year. So whether you're to that extreme or you're already back in the office, This provides you with another digital level. So if you're any one of the extremes and anywhere in between, you still have a program that's going to work for you. And that helps manage that risk from your perspective. Like I said, that social element, I think, Champ is kind of showing some of the badges here at the bottom of the
I know
screen.
I threw the slide at you. I know. But because it was honestly, these are some of the things that are so like it's helped our company tremendously. And keeping just keeping the connection. It's so important. The how easy it is to implement a fitness challenge throughout the company. How easy it is for us to be able to, hey man, say we're hopping on live this evening. We're talking about stress and anxiety, and it just makes our job so much easier, and also the social connection so much stronger. So like I said, I know I threw this at you, but I just love the app, man, and love what it's giving us accessibility to do.
And obviously, I'm definitely happy to hear that. And just to kind of elaborate on what you're saying there as well is a lot of the times when people think about customization, they think, oh, this is a lengthy process, etc. No, this is something that could be turned around very quickly. And kind of the benefit to that, if you're asking about how it works, in a matter of just a couple weeks, meeting with the team, identifying what are the key dimensions or dynamics you want to focus on, getting the program, the branding, the customization specifically for you. Basically, we're going to mass invite the individuals, invite them to the platform. Yep. When this happens, within just a few minutes, people can already activate their account, be in a custom wellness program, and already be interacting with different things that are live, such as always engaging to start out with a challenge from the very beginning. They're going to be winning badges as they start to interact through the system and experience it. And the other kind of cool thing about it is the team, based upon your conversation with them, are able to also publish content in here on a daily, weekly basis, whatever it may be. And the powerful aspect of this is individuals are going to basically get instructions or basically get the guidance to explore other dimensions that they maybe haven't thought about. And ultimately, we talk about every company's different, so is every individual. So you have this existing program for some people, maybe nutrition and monitoring their nutrition is going to be one of the focal points for an individual. Everyone's going to get a taste of the different dimensions that you're providing, and they're going to kind of cling to those focal points, which is going to basically make them more engaged in the overall program. And I would argue one of the biggest things is with wellness programs, you can always get better with them, right? Always can improve upon it. So using business analytics, using health risk assessments, or using feedback form is a great way also for us to not only see the engagement, but also identify where there's opportunities to improve it more, maximize it, create new iterations, and basically keep constantly improving the algorithm to get the maximum engagement out of a program we have. So in short, that's what the team will be able to provide to you. And yeah, this is kind of where the industry is going as well. I can tell you many Fortune 500s and some of the biggest brands in the world are following a similar structure to this.
Absolutely. Thank you, man. And that's you hit it right on the head. And this is, once again, I just continue to stress that the accessibility with Champion Elite Wellness, the flexibility with Champion Elite Wellness is there. We do everything from team building, lunch and learn, virtual workshops, nutritional workshops, as Derek just spoke about, the wellness portal, company retreats, anything that you can think of. And even if you can't think of, because what I'm noticing is companies don't really know what they want, what direction they're going in, because these are HR and benefits department that are wanting to do things, but they don't know what to do, what kind of accessibility they have. And so we help you not just facilitate these workshops. Well, we sit down with our team, and just how we have a team here, we sit down and we make sure that we customize everything all the way down to what we're dealing with now, virtual learning. putting together team building workshops, mindfulness hikes, company retreats, all kinds of workshops. You have accessibility to, for a turnkey program with Champion Elite Wellness. And you know, the key question: where does companies start from here? Where does employees start from here? We go off of this 4-pillar or this 4-direction when we're engaging to a company. We know the impact. We go into the company with surveys and health screenings, and to kind of know where the impact lies. And this is how we start to build out our programs. And of course, we make sure that the CEOs and executives are on board. We're realizing that when they're on board with the process, the company follows suits, and it really starts to breed a really good health culture within your company. So we work with you and your team, and my team directly, to know the impact. And then we start to break the silence. This is big when it comes to mental health. Really talking about it, making it a comfortable space. I know Tony knows about this better than anyone. Breaking the silence, start to talk about it, start to make it relevant, start to make it okay to talk about it, start to make it a non-judgmental space that you feel like you need a therapist. Oh my gosh. So breaking those stigmas. So breaking the silence is important with us. Also, we make sure that we deliver affordable access to everyone. And we will walk companies and employers through that process of how we're helping this process to be affordable and accessible. And then the biggest thing is we build that culture around what we know, the impact. We're breaking the silence, and then we build that accessible, affordable program for your companies. And just to wrap it all up, man, I just want to thank everybody for being on here. We currently are providing wellness for over 1,500 employees currently, and we want to invite you to be next. We want to invite you to really experience what it's like to have a real program that is fit for each and every employee and each and every individual, that it's effective programs, not just some, like we keep saying, this cookie cutter platform. And we want to give you guys that experience. So stay connected, stay in tune. You can follow us on our Instagram at Champion Elite Wellness, on our websites, championelitewellness.com, or even send us an email. Send us an email. Let us know how you feel about this webinar. What are your thoughts? And allow us to break those thresholds and break the stigmas, and start small. We want to keep it simple. We're not saying that we're going to come in and change your whole wellness program or try to build this crazy wellness program. We want to start simple. We start small, and we don't want to make this process an overwhelming process for benefits departments, HR reps. We help you all the way through and through. And we are your wellness escort when it comes to building a brand of culture and a big time culture in your company. So we start small. We want to invite you guys to stay connected. Send us an email and allow us to really gear your company towards a holistic health. I'm gonna end there, man. If you guys have any comments or any suggestions, please feel free to email us. There's also a comment box. You can drop any comments, give us some thumbs up, share this video. And I just want to thank all the panelists for taking the time out, especially in these trying times, to do so. Real quick, I love Tony's perspective, and I think everything starts with mental. Tony, if you can give us one takeaway, not from this webinar, but one thing that people can start to do today and tomorrow to help with to address this mental space, something that they can really tangible to take away from today and move forward to help with that mental health.
Sure. So one thing that you can do to start to improve your mental health is you can journal. So this does not have to be these very long storied entries, but you can start today by writing down just 5 things that you're grateful for in your life, because having that list and being able to see it tangibly in black and white, it makes it real. And it reminds us that even in all of the chaos of the world, even in the COVID, even in the political climate, there are things in your life that you are still grateful for. Everything isn't bad. Things are rough, but there are things to be grateful for. Gratitude goes so very, very far. Just being able to appreciate the little things in life, being able to stop and take a moment and literally smell the roses. Well, not roses right now because, it's fall, but being able to stop for just a moment and take in something that smells good, take in something that feels good to you so that you can have a little something to just be grateful for today.
Perfect. Like I said, thank you guys. If you have any comments, feel free. Any panelists on here, anybody wants to end with anything, but I'm going to end there. We don't want to take in people's too much time, but thank you guys so much for you guys coming on all across the country and the world to be a part of this. Thank you. And we're prepared to impact the world and really start to gear everything towards health and wellness. Thank you guys.